Hello, welcome to ADAPT ADAPT NCLEX. This is a site that I've created for new test takers for the NCLEX and those who've taken this multiple times and failed. There is hope. I've found tips and tricks to pass these exams, and I've begun with prioritization videos. I hope this is going to help you. After going through all multiple Q banks and reviewing the board exams, what the requirement, I realized that prioritization form portion of your large portion of your exams, and the trick to answer all these questions because it's very overwhelming, and that is what we do naturally in a hospital. We prioritize, but in order to prioritize, you have to have something to focus on. So I came up with this acronym: is to prioritize a patient is to be sharp, not expected. That means you're not looking for an expected finding. You're looking for things that will make you be sharp. And these things are breathing, which is the B. Any patient who have a breathing problem is a priority. Electrolyte imbalance, which involve calcium, potassium, magnesium, sodium, or whether the patient is in sepsis or is in shock, or whether they have hypoglycemic or they are hypothermic, or if they have airway issue, which is usually will present in restlessness, stridor, or drilling, or neurological problem, but not you won't see it as neurological. You see the patient is very lethargic, or just had a seizure, or the patient is grunting, or there's acute change in mental status. These are all the R portion of the BESHARP. And P, which is very important, is very confusing when it comes to pain, because your body can have pain everywhere, but the pain that is a priority is what? Pain that is going to cost your life, pain that will make you lose your limb, and pain that will let you lose your eyesight. So we call it life, limb, eyesight kind of pain. Therefore, any patient that will consider to take care of, and what we think is a priority, is anything that include BESHARP: breathing, electrolyte, sepsis, shock, hypoglycemic, hypothermia, airway, lethargy, seizure, grunting, acute mental status change, and pain due to life, limb, eyesight. If you write this down, every time they give you a priority question, you look if it's there, you get it. 99% of the time, this is what you're going to use. And therefore, we're going to use this to answer some two questions on UWorld, and you see how we can apply it easily. I like UWorld because the questions are very good. I'm not advertising it. But this is what a question you have. When they give you a priority question, you can see that they will underline it. It's most. So usually read the last portion of the question, then to find out what the examiner wants you to you answer. Then you read the first portion, they give you the scenario, what is the situation. Therefore, the answers, you compare each answer choice by going down and picking one. Your first answer choice will be your priority, and compare it to the second one, and you can drop it as you go down and use my BESHARP formula. So we have which manifestation is of most concern to the nurse. So the nurse is assessing a 58-year-old client with blurred vision and a reduced visual fields. So you put yourself in that situation. Which one you should be worried about? A patient who has a blurred vision and reduced visual field. You got to be sharp when you are assessing this patient. Difficulty adjusting to dim light. Well, if the patient cannot adjust to dim light, it look like this has been going on for a long time. How can this be sharp? Whenever we talk about eye problem, we're talking about pain that they're going to lose their eye. Difficulty adjusting doesn't mean you're going to lose your eye. So this is an expected finding. This is not a BESHARP issue. Therefore, we can eliminate that option without any problem. So we'll eliminate this option that is our priority right now. Number two, extreme eye pain. So you have a patient who has extreme eye pain. Look at how they qualifying it. That means there is a pain that is so extreme. If you don't do anything, it's going to lose their sight. So pain that will make it lose their sight. This is my priority. So it's a pain. I'll take it in right now. Gradual loss of peripheral vision. When you're losing your peripheral vision gradually, this is a chronic problem. So this is unexpected. You don't have to be sharp about it, even though you have to worry about it. Therefore, we can eliminate it. Opaque appearance of the lens. This is something that's been going on for a long time. How can you be sharp and prioritize this? We can eliminate it. This is a cataract. Cataract. Therefore, we will select number 2 as our priority. The next question is the same thing. We'll read the last portion of the question. Which client should the nurse call back first? So this look like nurse has a triage for patients. A nurse is working in a neurological clinic, receive the following telephone message. For patients, they have a problem. You have to take care of them, but you have to prioritize. And how do you prioritize? It's being sharp. Be sharp. Be sharp. So the first one, a client prescribed somatotryptin who has what? Throbbing left temporal pain. We have pain issue there, preceded by a horror. So this look like somebody who had a headache, migraine headache, had a horror before, and now they have left temporal pain. This pain is not limb, eyesight, and what? Life. Therefore, it's not a priority. But because that's the first question, it will be our priority. And this is expected. He's prescribed a migraine medication to take care of his pain, and this pain is not going to cause his life or limb or eyesight. But for now, it's our priority. 2, you have a patient client taking carbidopa, levodopa, who has dizziness rising from a sitting or laying position. The side effect of carbidopa is orthostatic hypertension, and patient is exhibiting the classic orthostatic hypertension. This is an expected finding. We have to be sharp, not to be expected. Therefore, we can eliminate this. So this is eliminated. This is eliminated. Number 3, client with myasthenia gravis, okay, who has fever, increasing difficulty swallowing. So patient has myasthenia gravis, he has fever, sepsis, and increasing difficulty swallowing. Your examiners will not tell you airway, but this is an airway problem. Therefore, is our priority right now. He has fever, sepsis, and airway. So it's the sepsis and going to go in airway issue. Therefore, it's our priority. We have to be sharp. A client with trigeminal neuralgia who report burning cheek pain after eating ice cream. Trigeminal neuralgia is due to cranial nerve 5, and usually you have pain in the distribution of the nerve, and it's burning pain when you eat hot or cold food. And so patient is exhibiting classic expected finding. The pain is not going to lose their life. The pain is not going to cause them to lose their life, eyesight, or limb. So this pain is not a pain for limb, eyesight, or life. Therefore, we will eliminate it, and then we'll be left with that patient who has fever and difficulty in swallowing as our normal priority patient. And as you can see, you can apply this easily to answer any priority question. 99% of the time, you'll be able, it makes you stay focused. This is what you're looking for, and that will keep you directed to be able to answer these questions. I hope you take care of yourself, continue to study, don't give up, you pass successfully if you apply this prioritization strategy. Take care of yourself.